Aloha, everyone, and welcome to another episode of From Anxiety to Clarity. I'm Beth-Ann Kozlovich of Sutter Health Kahi Mohala, and here we are coming into the last week of October as we watch the state open up to the Trans-Pacific travelers who have the pre-travel protocol. We've also had a couple of days of Oahu moving into Tier 2. Although some of those movements may seem a little smaller than what maybe some would have liked by this point, it is still forward motion. And we're going to take a look at what that may mean as we're considering the arc of the pandemic through the lens of mental health. And joining me today is Dr. Noza Yusufbekova, and she is the incoming president of the Hawaii Psychological Association. And we're very grateful that she was able to make some time to spend this morning with us. So aloha, Dr. Yusufbekova. Nice to see you.
Aloha, Beth-Ann. Thank you so much for your lovely introduction. It is my pleasure being here.
Well, you've been watching what has been happening, as we've all been watching and engaging and feeling all the things that we've been feeling, because none of us has been exempt from any of this. And I'm wondering, as you know, I mentioned so the arc of the pandemic so far in Hawaii, as we've come through the late winter into spring and summer and watched the surges happen, and now watching great surges happening on the mainland, which is leading to obviously concern here. But at the same time, people here seemingly feeling that we're having this sense of forward motion, that something better could be coming. Are you seeing in any way this show up in some of your patients, or is it too soon to tell?
Well, certainly, it's an ambivalent type of process. It seems like I have some of my patients who are extremely excited to gain a sense of normalcy, or excited to see a little bit of action happening outside, such as, simple stuff like traffic building up a little bit more now, or people being outside and taking pictures and really enjoying the outdoors. And then we also have another, group of people who are highly, highly anxious, and even more anxious now as we are opening up.
The group of people who are more highly anxious, are these people who have never sought mental health help before?
It's an interesting dynamic, because so these individuals, who are already predisposed to experience anxiety. And so I certainly have a cluster of new folks seeking mental health for the very first time in their life, simply because they just don't know how to deal with this anymore. They have exhausted all of their coping skills, all of their mechanisms of functioning on a healthy or healthier level. So, it's a cluster of new people reaching out to mental health providers, and also existing patients who have already been in therapy with me for quite some time, but now their anxiety has exacerbated because of this pandemic. Also, I'm seeing folks creating these psychosomatic type of symptoms because of anxiety. One day they wake up and the body just doesn't feel well for various reasons. It doesn't have to be, COVID related, but suddenly they automatically begin to really worry and stress over, oh my gosh, is this COVID? And, are my body aches related to COVID? Did I catch it somehow? Am I experiencing a mild version of COVID? So it's an interesting type of dynamic that I'm seeing in my private practice and also out in the community. Some people are just, highly anxious for, various reasons. Again, could be because of they were already exposed to anxiety previously, kind of like a pre-existing condition of anxiety. Now has exacerbated. Others just developed this new anxiety, and they're trying to learn, what is anxiety? How does it feel in the body? And most importantly, what do I do with it now?
You mentioned that there are people who wake with fatigue and they don't really understand why. And yet we know that there's only so much that a body can handle before it starts to rebel in various ways without necessarily saying, hello, it's this or it's that. It just simply wants to rest or stop or needs to have some intercession. so that there isn't this sense of onslaught. And people in many ways have felt that this has been an onslaught, a barrage of new ways of having to behave, understanding something that's been so contrary to our way of life here, where we're very huggy, we're very touchy, we share food, we share stuff, we have this sense of enveloping ourselves because we are, after all, on an island or in a set of islands and very far from everyone else. And so it's been a real interruption of the way most of us have been taught to behave. And yet, without that intercession, we would have obviously a lot of much more serious situations than we'll have happen. And people are learning the difference, and they're learning that love also means doing all these other things. So very clearly people have been able to learn and are continuing to learn so that they can protect others as they also protect themselves. All that said, though, when you are talking to your patients, and in general, when you look out at the community, are you seeing a sense of a real understanding and a greater level of not just understanding, but of responsiveness to all of this? Or is this just something that a few of us may be seeing in different pockets?
Not sure. What do you mean by that?
I mean that, you know, we've seen so much coming at us and people telling us the same things all over again. You know, the 3 W's: watch your distance, wash, wear a mask, all these things,
Right.
to where almost for some people it has become white noise and they aren't necessarily complying with it. And other people are jumping up and saying, yes, that's what you need to do, and becoming far more active as voices to say this is so important. And watching the disparity of those two ideas and the two ways that people are dealing, I'm just curious what you're seeing in your practice and in general when you look out at the community, as we've been talking about this for a long time, and whether messaging is working and whether people are really learning how to better cope with this in a way that's very different from the way that we've all been taught to behave, or that most of us have been taught to behave.
Yeah, and spot on there. You know, I'm noticing a very similar dichotomy. You know, we have a set of people who are highly conscientious and very pro hygiene and following the rules and being very obedient and compliant. And then we also have another set of folks who just, you know, kind of maxed out and they don't want to deal with this anymore. But a common denominator here is anxiety, because with, you know, anxiety pushes us towards action and activates the survival mechanism of keeping up with the hygiene, maintaining social distance, and following all the rules that will help you stay healthy and survive. And anxiety can also push you in the direction of avoidance. You know, this is too anxiety provoking. This is too much for my mind to handle. I would rather just escape and avoid, or just, you know, avoid of following the rules, avoid following all these precautionary measures. You know, but again, what is the common denominator here? And that is anxiety. Some people face the anxiety and take action, others avoid. And unfortunately, that's how we deal with, you know, as humans. It is not uncommon for us to avoid some kind of a threat or fear. And really, if you look at the, you know, neuroscience of anxiety, it, you know, it stems from a threat. And, you know, I will, it's a, you know, very basic type of explanation I'm providing here. There's, you know, the brain related type of activities that happen that start out with the amygdala. Amygdala is, you know, very old type of organ that we have in the brain. And, you know, so when the amygdala detects threat, the mind, you know, interprets the threat as fear. And as we, you know, the brain is a very complex type of organ. It will project fear into the future that will translate into anxiety. So, you know, we give into all the what if type of thinking, all the, you know, anxious type of thinking. Sometimes it becomes a little bit too much to handle, and a person naturally would try to avoid. How do you avoid? You avoid through healthy coping skills and also unhealthy coping skills. Unhealthy coping skills, as we know, is that's actually been quite prevalent is alcohol use. Alcohol use, substance use has drastically increased.
And has it increased even more than when we saw it increase when we looked back at it in the spring? Because that made a lot of news around April.
It started
that people were
absolutely
buying a lot more.
Spiked up. Absolutely, it spiked up, and right in the beginning, in the first round of quarantine, then it kind of leveled out, and it spiked up again. And if I, recall this correctly, Maui, the amount of the number of DUIs that the police officers reported, it just tremendously amplified. I don't know what the statistics are here on Oahu, but Maui seems to be really, really hit with this poor coping skill of alcohol use and drunk driving and other substances, unfortunately. Yeah, but then if you look at it, why are we given into unhealthy coping skills? Our healthy coping skills were taken away, such as, going out for a walk or exercise. The gyms have been closed. The parks have been closed. Movie theaters, or just, meeting with friends for a cup of tea or coffee at a coffee shop. Going to the mall, just window shopping, all these pleasant activities that we were able to do in the past safely with full confidence and trust. Suddenly that's been taken away. And, when you're cooped up in the comfort of your home, certainly it's nice in the beginning. And then over time, boredom kicks in. And over time, the mind just tries to look for, well, what can I do? And if you pair it with negative emotions, it's easy to reach for alcohol. It's easy to reach for other unhealthy habits, overeating, just sleeping too much, or even maybe not following your proper sleep hygiene. That's, sleep problems actually been another problem in private practice. I have quite a few patients who have been just completely off their sleep pattern for various reasons, unemployment, anxiety, worry, substance use, family conflict that adds on to negative emotions and anxiety. So it's a very complex type of process.
In looking at where we were even before COVID, when we knew, for example, that approximately 20% of our population over the age of 13 would experience some form of mental health issue in any given year. And now we are dealing with COVID, and many mental health professionals say we're going to see waves of this as we move into the future, because we just don't know what all of what you've just described really will mean for us long term. There are no longitudinal studies about what happens when you have somebody in a pandemic of this type, because we've never experienced this. So there's a great deal of unknown, leading to another set of anxieties. But with children, with adults, with all of us coping with each other, we really don't know what the coming years may mean for people's mental health. Just looking at the Mental Health America, their annual state of mental health in America, and some of the stats which haven't changed since before COVID or have worsened since COVID. One of the ones that really struck me was that, youth who are experiencing severe depression or anxiety, particularly if they are, self-identifying as being of mixed race, that shot up to 12.4%. And that's a lot for just, that demographic. It's a little lower, although it went up by 0.5 percentage point for youth in general who are in that category. But as we are here in Hawaii, and so many people are of mixed race, and that we regard ourselves as this great place where you can be of mixed race, where that seems to be a normal thing. Are you at all concerned that this will strike us more than in other places?
Absolutely, absolutely. This statistical data is very, very concerning, and we're still, just on standby for increased rates of depression and anxiety. The most recent research actually, says that the prevalence of depression and anxiety is more than 3 times the rate in 2020 than it was in 2019. So intuitively, as psychologists, we kind of know that, okay, it may get worse by the end of the year, but, beginning of 2021. So, we are definitely mindful of, of this situation and the long-term effects of COVID. At the same time, Beth-Ann, if we, really think about this year has been extremely challenging, not only with the stress of this pandemic, but also, pre-existing issues coming to surface, like the systemic racism, police brutality, extreme political division, financial uncertainty, the economic crisis here in Hawaii and on the mainland, parental burnout, the collision of work and home life. I mean, how do you manage all of this? Or decision fatigue, just simple decision fatigue. Do I let my child go outside and play because he needs a little bit of fresh air and exercise? Or do I keep him safe at home? Or do I send my child to go to school on campus? Or do I keep my child here at home? So this ongoing decision making and just everything that we've gone through so far in 2020 has been absolutely mind-blowing. And so, I won't be surprised if depression and the rates of depression and anxiety increased even more in 2021. The American Psychological Association releases an annual report of stress in America. Interestingly, they began to release this report, Stress in America report, every month starting this summer, and it explains why. Their recent survey found that 72% of Americans reported that this is the lowest point of history that they can remember. At the same time, though, another, on the positive aspect of this, so if we have to, evaluate some negative effects of this pandemic and also bring in a little bit of the positive effects of this pandemic, interestingly, about 82% of parents also reported that they were actually quite satisfied being home with their children, being able to connect with their children. So it's an interesting dynamic. And, from a mental health perspective, we are prepared to see, an increase in depression and anxiety, and even maybe post-traumatic stress disorder, grief, financial stress, and other psychological factors and stressors. At the same time, though, as psychologists, I think it's also important to identify some of the positive effects that, this pandemic brought us, such as, maybe, finally connecting with family, or slowing down with work, or becoming more mindful of our health, our hygiene, or different habits that we need to pay attention to.
And we've heard that in some of the conversations that we've been having over the time that we've done this series, that, this is not all just a dark story. Now, this is not to minimize in any way, shape, or form those families who have had family members lose their lives because of COVID-19, who are experiencing incredible economic stress and family stress for so many reasons. But in there are these positive nuggets where those, if capitalized on, might lead to a better post, at least post lockdown, post having to deal with restrictions world. And that may not be for another year or so. Once we actually have a vaccine that works, that's widely disseminated, we're probably looking at about another year if we listen to some of what the national sources are telling us. But that to the side, though, one of the things that I wanted to talk to you about a little bit is that, we have kids who are already dealing with mental health issues, all kinds of issues. And for some, this has just become just another one in the pot that they have to cope with. And depending upon whether they are being treated, and most of them aren't, I think the Mental Health America said, 60% still aren't getting treatment, those who need it, and 60% not getting it. And so we've got that issue that's brewing too, not just the ones that may be new to the scene, but those who are also really needing treatment that we knew about. How are we able to, or what do you see as being the path forward to be able to ready this state so that we're able to better cope with all of our kids and our youth, as well as our adults who need mental health treatment, who may have, not been getting it before, or maybe getting some of it before. And now they, plus all this new contingent of folks, both, youth, child, and adult, it's going to be huge, which sort of leads back to the idea of the wave. But knowing that it's coming is one thing, but how do you see our state either, preparing well for it or not preparing well for it? And what are you doing with the Hawaii Psychological Association to be able to move that in whatever direction you think is appropriate?
This is an excellent question. And, it comes down to education. We really need to take the time to educate our children and our youth and educate them or speak to them on their level that they can understand, and not assume that they will get this concept right away or assume that they will remember this. Children and especially adolescents, they go through this, short phase of hypofrontality, meaning that the executive functioning is just not just there yet, not fully developed, which means, they may need frequent reminders. They may need some reminders to slow down a little, not to act on their impulses, really, just continuously reminding them about their hygiene and the importance of washing hands, importance of maintaining social distance, especially, wearing masks and stuff like that. So I truly believe that if we continue educating our children, continue educating our adolescents, and continue having these meaningful conversations with them and checking in with them in terms of, well, how do you feel about this? How does this make you feel? And as opposed to, give in to our own assumptions, whether as parents or teachers or even professionals. It's important to tap into their internal world and, really allow them or give them space, safe space to express themselves and see what it is like for them to be going through this type of pandemic or this major change.
You make the point. I'm sorry, go ahead.
No, sorry, go ahead.
No, I just wanted to ask you about one of the points that you just made, because, we know that kids have a really hard time being able to see the consequences that may come down the pike, because they're, really, if they can see next Tuesday, that's far, and
exactly.
That has always been a tough thing with understanding what consequential thought, or when that really begins to crystallize in the mind of a young person, and usually not till they're well into their 20s. And so for kids who are feeling this incredible sense of grief and loss and lack of ability to rise up, for a lot of them, that's leading them to suicidal ideation, some of them to try it. We're seeing that our suicide rate or attempts of suicide also increasing. And that's a very scary thing for all of us, but especially for those families who are involved, who may not even realize that a child may be in trouble, or may see that this is the only way out, or that the world doesn't welcome him or her. So who would care? Particularly for our kids who are really in at-risk situations, that really becomes quite a concern. And I'm wondering what it is that you would like to see us focus on more, or how, under your leadership with the HPA, is this going to become something that we're focusing on a little bit more?
Absolutely. I think it is a very important area to focus on, and, again, to pay attention to those children and adolescents who already had a pre-existing condition of depression, anxiety, or, trauma, childhood trauma. coming from abusive households, domestic violence, ongoing or chronic interpersonal conflicts and stuff like that. This pandemic is not helpful, for that population specifically, because it really creates even more isolation, more loneliness, more grief. And it's important to highlight non-bereavement type of loss, meaning that the loss of certain friendships, or the loss of going to school, or
routine.
hoping to see your cousins on the mainland, or planning for this vacation, or hoping to do something outdoors, either with friends, or joining some kind of a club, or just doing something that's very simple, adolescent, childlike related type of activity. So that type of loss is also important to address, because that can easily feed into depression, that can easily feed into hopelessness, and hopelessness is a primary factor that leads to suicide and suicidal ideations. So again, being open with children, with adolescents, and asking them how about their emotions, how do they feel, how are they coping, also helping them to focus on, well, what is going well when everything else feels just so yucky and negative, really helping them shift their mind to a little bit on the positive side of the spectrum. And it can be something very small and basic, that hey, I got up today, I made my bed, or I took a shower without being yelled at by mom or dad, or I attended my online class without being prompted by a parent. So it's very small actions that can be celebrated and can be very validating as well. And it's important to validate what they're going through. And it's important to give our adolescents and children a safe space to process their emotions, to really ask them, what has it been like for you during this pandemic? Because this is an individualized type of experience. Although we are all in this together, there's this common humanity. And at the same time, this is an individualized type of process.
Leveraging that thought to the entire population, we've got lots of subpopulations here too, which exist in a very different way from each other. And yet, as you say, there's this commonality of the experience. We were shown not that long ago that we weren't really paying attention to subpopulations. And we watched, for example, the COVID spike happen within the Pacific Islander community, because we really weren't talking to them specifically in the way that you mentioned a moment ago, speaking to someone in their own way, whether it's a child or an adolescent or an adult. Do you see that we're going to have more of these kinds of conversations or hooies happening within subpopulations going forward, to be able to cope with whatever mental health waves continue to happen through 2021 and beyond, as we have all of us trying to cope with life with COVID in whatever form it may be?
Absolutely. I think it's important to proceed mindfully, and especially culturally mindfully in this situation. Every culture has its own rituals, traditions, values, beliefs. Some cultures are very collectivistic, which in this situation may not be helpful, because, I come from a collectivistic, culture and family. And, I've gotten used to greeting my mother with hugs and kisses. I've gotten used to greeting, my other family members with hugs and kisses. And suddenly that has been taken away from me. And that feels uncomfortable. That is unnatural. And for, other cultures or subpopulations, it's important to address what is within the cultural norm. And it's important to continue to educate and implement, positive changes that, and also safe-like type of changes that will help them in a way preserve their cultural traditions or rituals and stuff like that. And at the same time, being mindful of each other, especially, um, those folks in multi-generational type of homes, and being mindful of not um, transmitting this virus onto others and stuff like that. So again, being culturally mindful is crucial here.
As we move forward with mental health, which seems to be having, I don't want to just say a moment, but that there's at least a lot more attention being paid to mental health, where it's showing up in tweets from the governor and certainly from the lieutenant governor and all the organizations within Hawaii, which are trying to focus on their particular niche of mental health, as well as the Department of Health. How do we leverage this time with paying attention to mental health into greater parity with physical health?
Mm-hmm. Well, how do I answer this question?
Well, it's one, Noza, we've all been wrestling with for a very long time, because we see that when the emphasis has been placed on health, that health is talked about in very physical terms. And yet one's mental health is very allied with one's physical health. I mean, there's that adage that, body follows mind, et cetera. But,
Absolutely.
Forgetting that we've never really come to terms with it. There's always been that stigma, which is, slowly, ever so slowly, seemingly like it's just disappearing in small bits. But to really have parity with wellness, with physical and mental health, to create total wellness, that seems to be showing up in ways that we haven't seen before. How do we push that envelope out more so that it doesn't become a big deal? I mean, once upon a time, it was a big deal to talk about cancer. And I can remember older members of my family whispering about it as if even just talking about it meant you might get it. And the same thing applied to, mental illness or just any sort of mental health issue, that people were very reticent to talk about it because it meant something terrible for your family. It was a black mark potentially. And now the openness to talking about it, obviously we have celebrities, we've got people in sports and athletes and all kinds of people who are, heads of great companies who are talking about their own anxiety, their depression, their feeling of alienation, all those things. How do we move this so that it doesn't become such a big deal anymore to talk about, any more than you would talk about heart disease or diabetes?
Right. Yeah. Well, we've already, kind of started normalizing mental health in a way that you don't have to be completely crazy to go see a shrink. Historically, you had to be, a person with schizophrenia would be the only person who would end up seeing a psychologist or a psychiatrist. And certainly, and thank goodness, times have changed. You can see a psychologist for stress management, or just for some life transition or life transitional type of issues. And I think the people are beginning to talk more about that, and people are beginning to view mental health as not as scary as it was before. And what I really appreciate is the movement of integrative health, meaning that primary care doctors, primary care physicians are beginning to collaborate with behavioral health professionals, and they're beginning to make these referrals to psychologists, therapists, social workers, and stuff like that. So, we are getting a sense of collaboration, and I think we just need to continue strengthening that. Continue reminding people that, it's okay to, it's okay to take care of your brain, because we've gotten so used to taking care of our eyes, our teeth, our ears. We have all these different specialists for every part of the organ, if you really think about it. But then we forget about the brain. and it all comes down to let's take care of the brain, and it's okay to see a psychologist to attend to your brain. You don't have to have severe mental illness to see a psychologist or a behavioral health professional. So we're beginning to see more and more of that, and my hope is that we'll continue normalizing mental health and you slowly shift away from the stigma that's associated with something really heavy and negative. Again, it comes down to education and providing accurate education and openly, talking about this and normalizing it and validating it. Negative emotions a lot of times, or avoidant behaviors a lot of times, stem from some sort of invalidation, meaning that if you share with a family member or with a friend that, hey, I have an appointment with my psychologist, and suddenly there's this reaction like, what? Like, why do you need that? Just talk to me, I'm here for you. And that's, although the intention is good, but that provides invalidation. Suddenly you begin to feel ashamed of having this appointment with your psychologist. So again, it's important to provide accurate information, accurate, education related to why do we have psychologists, why do we have psychiatrists, or master's level therapists and social workers, and let's utilize this help. Insurance companies do a great job covering for all of these services. It's readily available to most of us, and let's utilize this, let's integrate it, and let's pay attention to our brain health.
All those things I think that would be on, well, certainly on my wish list for us as we go forward. There's also the reality that we don't have enough docs. We don't have enough specialists who know how to deal well with children, whether they're a child psychologist or a child psychiatrist, adolescent specialists, all kinds of people. You mentioned that different organs have their own various specialists. We need more of those specialists in Hawaii too. How do you think that we can attract those or grow more of our own in the current situation?
Absolutely, absolutely. Well, I think it has been an ongoing type of challenge, not only for the adult population, but even more for children and adolescents. And you're absolutely spot on. The shortage of psychiatrists here on the island who would see children and adolescents is just outrageous. So how do we do that? I think it's important to provide these opportunities or educational opportunities to our local population who wishes to go to school, who wish to pursue higher degrees and graduate schools, but they may not have the funds to do so. They may not have stable housing or other financial type of opportunities to reach their goals. So I think it's important for the state to evaluate some of their funding and maybe allocate some funding for our local students who wish to pursue graduate schools and would like to continue to stay here and provide their services here in Hawaii. So it's a combination of providing opportunities to our local population, as well as improving the financial health. In terms of inviting people from the mainland to come live here,
that may be more difficult.
That may be way more challenging, given the cost of living here. I mean, on one side, it seems very attractive to move to Hawaii and live in Hawaii, but then on the other hand, you just feel like, is that financially feasible? Because
it's so far.
And it's also very far. So, if we focus on who do we have here on the island, who are our people here who actually want to go to school, want to provide services for Hawaii, and who also understand the culture, understand all the crises that we've been through here, which can be quite different from the mainland. So if we focus on that, I think we may be able to improve our shortage of providers and maybe figure out a way to compensate or yeah, provide a little bit more support there.
Right, you're talking about the issue of cultural competency wrapped into all of what one would have to have from a professional standpoint. Also, looking at the fact that we've seen telehealth bloom and just exponentially just rise above where the plans were for it before COVID, just by necessity, having to go through this process and have these screens be the way in which you could access someone for all kinds of health needs, but especially for behavioral health. Have you found in having to deal with people through a screen like this that you're having more issues come up for them than you had before, because it's such a different medium, and learning how to have that sense of, I don't want to say intimacy, but to be able to talk with someone and look at them and see more than just what happens on a flat screen? I ask you this because some people have said, no, really, it's been okay. And others have said, it's really been difficult for some of our patients to get through that. And I'm curious what you've been experiencing.
It's a very interesting dynamic. What used to be called couch therapy turned into bathroom therapy. And I'll explain in just a moment. So the beauty of telehealth, you have this accessibility to your patients, your providers, and so on and so forth. So yes, it is connecting. You still maintain a pretty good therapeutic alliance and rapport and all the, therapeutic ingredients that are needed. And at the same time, it's a complicated dynamic because suddenly the only place a patient can have a therapy is in the bathroom. So I've been seeing quite a few people in their bathrooms, and it's okay. If this is what we have to do, that's what we have to do, because this is the only confidential place, or the only place where they can be in their own privacy and not interrupted by children, spouses, family members, and so on and so forth. And if that's what we have to do, that's what we have to do. So in one aspect, it has been working out quite well, especially for a more vulnerable type of population with immunodeficient systems, and really need to take good care of themselves, especially in the beginning of the pandemic. So that was, telehealth has been a wonderful tool to keep their anxiety in check, or just to stay connected with people, to help them get through this pandemic, or the peak of the pandemic back in March, April, May. At the same time, for other people, it has been very problematic for people who don't have reliable electronic devices, who may not have good internet connection,
or any internet connection,
or they would just have to do a phone session as opposed to video, Zoom, or other telehealth platform. Also understanding that they may not have a safe place to fully express. And I did notice right away the shift in that energy or self-disclosure with some of my patients. Suddenly, they're a little bit distant. And then I really realized, wow, okay, so you're not by yourself. You can't talk freely. And they say, yes, that's right. I really want to have the session, and yet I can't say everything I need to say because I'm not by myself. And
so they're self-editing and self-limiting, and so you're really not being able to do as much as you would like to do or could do if you were together as usual.
Absolutely.
So,
and this
go ahead.
And this calls for, cognitive flexibility. You just, meet them on their level. You identify their needs right there in the moment, and you just go with that. So I've noticed that I myself had to really check in with myself with my own flexibility, because I've, gotten used, or I was trained to do therapy in a certain way,
right,
in a certain setting, under certain conditions, and suddenly I feel a little off because I have to adjust to what is happening on the receiving end.
I think if there is really a through line for this conversation, and for perhaps the entire COVID experience that people have been having all this time, it really is that cognitive flexibility and learning how to respond differently and being okay with it. And I really want to thank you for the conversation this morning and for just everything that I know that you're doing with the Hawaii Psychological Association and that you will do during your tenure there as president. And I really want to wish you all the best with all of that. Dr. Noza Yusufbekova, thank you so much.
Thank you very much. It's been my pleasure. Thank you for having me.
And thank you for joining us for another conversation from anxiety to clarity. If you would like to suggest a topic for us, you can always reach me at my email. It's kozlovb, it's K-O-Z as in zebra, L-O-V as in Victor, B as in boy, at sutterhealth.org. And if you have a question, you can send it to that same email too, and we'll make sure that you get an answer. Otherwise, we will see you next time right back here for another conversation taking us from anxiety to clarity. I'm Beth-Ann Kozlovich. Aloha.